Good afternoon.
Hello.
My name is Rose. I'm the nurse practitioner who's going to be taking care of you today
Okay,
for
nice to
your
meet you.
assessment. What's your name?
My name is Lori Omalo.
What's your date of birth?
November 18th, 2005.
Correct. So I'm going to step aside and wash my hands and get ready to start the procedure. And I'm going to explain the procedure to you, okay?
Okay.
Okay, already. So we're going to do a head and ears and neck assessment.
Okay.
And I'm going to be touching you in different places. If you feel uncomfortable in what I'm telling you to do, feel free to let me know.
Okay.
So I'm going to start with your head first, okay?
All right.
So on inspection, when I look at your head, the hair looks good, the hair distribution is okay. There are no deformities on your head. I can see the size of your head is normal for your age.
Okay.
So I'm going to be touching you now just to check your scalp. And I'll start with the back to feel if there are any swellings or any depressions that we might not be able to see because of your hair. Looks okay. There's none seen. And then I'm going to be patting your hair a little bit so I can see if there's any dandruff or any patches of alopecia.
Okay.
There's nothing.
Okay.
So your hair is evenly distributed and the scalp looks healthy.
Okay.
So the next thing we are going to be checking is your ears. So I'll start with this side. If you can turn a little bit to that side.
Yep.
So I'll take my otoscope and on inspection of your ears. Oh, you have growth here. What happened here?
That's a keloid that I got from a piercing a couple years ago.
Oh, okay. You've had it for that time? It's not painful?
No.
Okay. So I'll pull your pin. Do you feel any pain?
No.
Okay. So then now I'm going to use my otoscope to visualize inside your ear. On inspection, your ear looks clean. There's no discharge coming out. And then once I put in my otoscope, the lighting, your tympanic membrane is not bulging. There's no redness. Your ear looks good. And so I have to pull it up and out. There's nothing in there. So you'll turn to the other side for me. Thank you. I'll pull your hair back a little bit. So I'll pull your ear up and out again. We'll put the light in there and check your tympanic membrane. There's no inflammation. There's no discharge. There's no redness. It looks good. If I pull up your ear, does it feel any pain?
No.
Okay. So you can sit to the front.
Okay.
So there are a couple tests that I will do for your ear just to see whether your sound conduction is good.
Okay.
So I'll do the Weber test. So I'll hit this fork on the table and then I'll put it on your head. Then you'll tell me where you can feel the sound.
Okay.
Put it on your forehead and you can tell me what the sound conduction. Can you hear the sound?
Yeah, both sides.
You can hear it on both sides? Good. And then the other test that I will do is the ringer test. So I'll use the same fork and put it on different parts of your ear and you'll let me know whether you're able to hear it.
Okay.
So I'll put it on the back of your ear here, on the back of the pinna. Can you hear it?
No, not that well.
Okay. And then I'll bring it out the front here. Can you hear it?
Yeah.
Okay. And then we'll do the same on the other side. If I do it on the back of your ear, can you hear it?
Yeah, a little bit.
And then if I bring it to your front?
Yeah.
Okay. So air conduction is supposed to be greater than bone conduction.
Oh, okay.
So
yeah.
that looks good.
Okay.
And then I think we are done with you. If you can close one of your ears for me, then I can be able to do a whisper test. Just hold on to your... And then I will cover my mouth a little bit so you cannot you cannot lip my lid. So I say something and then you repeat it to me.
Okay. Testing.
Good. Cover the other side.
Brain.
Good. That looks good. So I think your ears are okay.
Okay.
So the next thing we're going to do inspection of your nose.
Okay.
So we'll start with checking your nails. They look symmetrical. There's nothing coming out, no discharge. So I'm going to take my light again and check you to see if there's any polyps or any growth inside. So I'll put the light here and I cannot go too much inside because the nose has very many capillaries and we don't want to hurt you. So it's nice and red, no inflammation and no polyps. We'll go to the other side and do the same. It's nice and red, there are no polyps, there's no discharge, and the cartilage looks okay. So that's it for your nose. And then now I'll check your sinuses in your nose. So I'll start with maxillary sinuses. If I press you and you feel any pain, just let me know.
Okay.
So your sinuses don't feel like they're tender. And then I'll go to your sphenoid. Any pain there?
No.
And then I'll go to your ethmoid. Are you feeling any pain there?
No, no pain.
And then I'll go to your frontal sinuses. Are you feeling any pain there?
No pain.
Oh, your sinuses are okay.
Okay.
So now the next thing we are going to do is check your oral cavity.
Okay.
So we are going to check whether your lips are pale or they're dry. And then I'm going to go inside and also check your oral cavity inside and see your the health of your teeth and your mucosa. So your lips look good. There are no cracks, no nothing happening in there. And then if you can open your mouth for me. Your teeth are also clean. They are nicely cleaned. You're not missing any teeth. If you can open your mouth for me. I'll check your buccal mucosa. It's nice and pink. No sores, no chancres. On the other side too, your buccal mucosa is clean. And then I'll check your palate. It looks okay. I'll use my tongue depressor. Can you do Your uvula and epiglottis are okay. There's no inflammation. There's no discharge in there. Your tongue is nice and pink.
Okay.
So far everything in your mouth, your gums looks okay. They're not inflamed. They're not sore. They all look good.
Okay.
So the next thing we are going to check is your nodes on your neck. So I'm gonna check your trachea. I'll palpate it from side to side and push it on the side. No growth. It looks good. It's mobile and it doesn't feel like there's any growth.
Okay.
That's okay. So the next thing I'm gonna check is your tonsils. So I'm gonna put my hand here and I'll ask you to check your thyroid. I'll ask you to swallow. I'm able to feel you swallow and there's no tenderness. It looks like it's good. Can you face this side? And this side? Okay, now we're going to check your nodes.
Okay.
So I'll start with the back, which is occipital nodes. They don't feel like they're swollen. And then I'll come to the superficial clavicular cervical nodes. And then I'll come to submandibular nodes. They're not swollen. And then I'll come to the submental nodes. They don't feel like they're swollen. They feel like they're okay.
Okay.
Everything looks okay, Miss Omolo. So until your next appointment, I think I'll see you then.
Okay, thank you, Rose.
You're welcome. Bye-bye.
Bye-bye.